For a long time, we held the belief that bed rest is a good thing for recovery, such as from a disease or trauma, or when we are sick, such as in the hospital or even at home when we're like taking a day off from school. I remember, get to sleep all day. But are there dangers to prolonged bed rest? Why are therapists such as physical therapists, occupational therapists, and even speech therapists often insisting that you get up to do therapy and bug you all the time? Are they just doing it to just be annoying, or are there benefits to getting out of bed for therapy even when you may not feel so good? Maybe you may be symptomatic, maybe having pain, whatever it may be, and you don't feel like it's necessarily the right time yet. So when is it a good time for you to get up for therapy? Is there such a thing as too early? If you are new to this channel, my name is Jeff, and I'm a board certified and licensed occupational therapist practicing in America. A common misconception about occupational therapists is that they help people find jobs, but instead, they help people to do the things that they want to do that are meaningful to them. My goal is to increase awareness about the profession of occupational therapy to help people live healthier and happier lives. If this resonates with you, consider subscribing to this channel and joining to be a member. Check out the video description for other ways you can help to support this channel. I'm Jeff, the OT Dude, and let's get functional. In an article titled "The Evolution of Bed Rest as a Clinical Intervention," the practice of bed rest as a therapy can be traced back to earlier history, even Hippocrates' time. So bed rest was often prescribed when one is sick or ill, and it probably still often is, and you may hear, say, your parents or your family members prescribe, hey, just get some more bed rest, right? And not only that, but many healthcare workers today commonly still use bed rest as an intervention, such as for those with pregnancy. However, this may not be the best intervention for patients, we have come to find actually. In fact, some healthcare workers are slow to change this belief of bed rest as being a useful therapy when the studies really are not showing that to be the case anymore. So many studies now across different professions and specialties are showing that unnecessary or prolonged bed rest, also known as immobilization, has its downsides. Immobilization has been shown to reduce people's walking speed, which is actually a good predictor of one's overall health. It can reduce function and also aerobic fitness, especially in older adults. Your cardiovascular system may begin to show an increased heart rate because it has to work harder to keep up with the same activity, and you may even be symptomatic, such as getting dizzy when you try to get up. And this can add to the cycle of making it difficult to get up later on. When you feel dizzy, then you don't want to get up, then you get even more dizzy and weaker, so it feeds on it. So at some point, you kind of have to break through those concerns and fears and anxieties and get up with therapy, right? Because there's also a high risk of developing venous thromboembolism, or a blood clot in your legs, and it can become dislodged and can result even in death if it results in something like a pulmonary embolism. And what's more, immobilization can result in muscle loss. Hear this, muscle loss strength as much as 10 to 15% of your total strength each week that you stay in bed and don't do anything. That means that nearly half of your normal strength is lost within 3 to 5 weeks of just immobilization. So being a couch potato actually can make you weaker and potentially even kill you. Other potential musculoskeletal complications even include developing contractures, so your muscles shorten and you're unable to use them and they kind of lock up in place despite you trying to use another arm or other body part to move it. It like physically, like a rubber band, cannot stretch anymore and just becomes stiff. There may even be an increased risk for osteoporosis because your muscles are so used to doing the things that they are intended to or have been doing their entire life and no longer. And if you're at increased risk for this, such as being an older female adult, you may even have a higher risk of developing this. So now that you understand some of the dangers of prolonged bed rest, you may be wondering, well, when's a good time to get up? Is there such a thing as too early, right? I alluded to this earlier. After all, you may still be in a lot of pain, may not feel good, so especially after like a car accident where you have multiple broken bones and things like that, and you may be all swollen up. Well, one thing to keep in mind is that while you may have a sustained injury or disability in one body part, there are still other parts of your body, most likely more often than not, that are still working and are still strong. For example, if you broke your arm and you still have good use of your legs and you can probably walk around, right? You just can't use your arms as much, and vice versa even. Because you need to maintain the other parts of your body that are still strong, or they can become weaker too, and leading to your overall body becoming even weaker and thus feeding into that cycle. And it's not just your musculoskeletal system that can get weaker and get deconditioned. It can be your heart, your lungs, your cardiopulmonary system, even your brain, right? If you don't use it, you kind of lose it, the saying goes. The same can go for your mental health and what kind of we are seeing in the research from things such as dementia and Alzheimer's. And some of the clues, maybe we're just not using things like our brain as much. So being in the hospital, if you're just kind of vegging out and watching TV all day and sleeping, is that the best thing for your brain? Probably not. Not saying that that's completely a bad thing to do, but doing it 24/7 and just kind of waiting for things to get better, it's probably not going to happen. So it's important to basically get up for therapy to improve your overall physical health, but also your mental health, even your spiritual health. And while there's like nothing really wrong with rest and sleep, doing it all day and laying in bed does not challenge your body and your mind and your everything for optimal health. And it's probably better for your mental health too to move around and go someplace else, right? Such as being in the shower or going outside, getting some fresh air. Of course, this is a general overall concept and it's not a case-by-case basis, as some patients may not be appropriate for this, such as being in a coma or being in a severe life-threatening condition and other serious conditions or end-of-life, things like that. So, how early is too early? Well, there is a practice called early mobility, and it is a research-backed effort to get patients out of bed and at least doing something, such as standing up or stretching or even taking a few steps. And yes, they may even do this in the ICU with therapy, like collaborating with the physical therapist and the occupational therapist and you and maybe some family members and nurses. You may be trying to take a few steps in the ICU with like a bunch of lines coming out of you, an IV pole, tubes, monitors and sensors, all sorts of stuff. Don't worry, we'll be managing all these things. Your job is to maybe take that first step and stand for a little bit or check yourself out in the mirror and maybe comb your hair and brush your teeth, because being in bed all day probably does bad things to your hair. I have seen it, especially for the ladies. My goodness. Us as humans, we are activity-based individuals. We have evolved to move around. You can imagine what this can do in terms of making someone feel empowered and functional after being stuck in bed, like all the way up to that point, and being able to say use the bathroom or go on an actual toilet and not have to use the commode anymore or pee into a plastic bottle. And that's what occupational therapists work on. We help people to do the things that are meaningful to them, such as being able to use the bathroom, like the actual bathroom, or to get dressed or get changed, or to take an actual shower. We call these the activities of daily living, by the way. And participating in these activities of daily living, ADLs, is even considered therapy when you're working with an occupational therapist. Pretty cool, huh? Occupational therapists also work on other functional things too, and they don't just only work on ADLs. Say they may work on you with making a meal in the kitchen if that's what you did before, or paying your bills, how to fill your medication, like weekly bottle in organizer, or how to take care of your plants. Whatever it is that you did before or you're interested in doing after your stay in the hospital, we try to work on those things with you. And in one study, therapists who used early mobility for a group of critically ill patients in the ICU, they found that early mobilization helped to prevent acquired weakness from prolonged bed rest from being in the ICU. Of course, therapists don't just get all patients out of bed regardless of their condition, like I mentioned earlier. It is a well thought out decision with permission from the doctor based on many factors, such as how you're presenting, what symptoms you're having, your vitals, what your labs are, where you're at and how you feel and things like that. And whether it's basically a risk benefit kind of comparison. And you may feel some uncomfortableness like getting dizzy, you may feel weak, you may even feel some pain, but we try to time it with nurses and try to manage your pain with things like medication to help you prepare for those small goals and small steps to lead into the bigger step, which is eventually to prepare to go home. And while I am not necessarily an advocate in saying that no pain, no gain goes for you, doing just the simple things is the first step in recovery. And sometimes these symptoms and pain comes with it as a side thing. Of course, we try to minimize it as much as possible. So one way to think of it is that it's just one step closer to being home and going home. So the next time that you may be in a hospital or visiting someone in the hospital and a therapist comes by and asks to work with you, don't just quickly dismiss them. Have a talk with them and ask what they're thinking and why they think you should get up for therapy or do whatever it is they think that you both should agree on to do. And it's not necessarily what they want to do, the therapist, but it's a collaborative thing these days. And we try to work with you to make sure we try to meet your goals, your individualized goals in the hospital, in rehab, at skilled nursing facilities, wherever it may be. So that is a cool change that I'm excited to bring and work with my patients and clients. And I hope you guys want to work with us too.